Hello, my name is Drake Basson, and I am a nursing student at Indiana State University. And this is a project for my community health nursing class. And this project is on communities around the world are at risk for disaster situations and the value of utilizing nurses as a vital resource. My learning objectives today are: what are some examples of disaster situations? What groups are vital to disaster education? Give examples of vulnerable populations in disasters. Give examples of the benefits of educating to vulnerable groups. List ways nurses can be involved during disasters. List the phases of disasters, challenges nurses face, and recommendations. Please pause the video for a pre-test of your knowledge on this matter. This is a 10-question pre- and post-test on disasters. Thank you for taking the pre-test. Now I'll begin the presentation. Examples of disaster affecting populations. There are three main types. The first one is natural disasters, which is hurricanes, floods, wildfires, earthquakes are often related to weather extremes. Also, man-made disasters like terrorism, shootings, assassinations, bombings, and nuclear war, such as the event on 9/11. And other disasters like disease and infection that is widespread and impacts populations at every level, such as COVID-19. Impacts on communities due to disaster situations. All communities are vulnerable to damages and suffering. Severe and life-threatening injuries leading to chronic health conditions and increased mortality are all related to disaster situations. Also, financial impacts on many levels of society, including personal income, local, state, and national crisis is all involved. Environmental factors like harm of wildlife and displacement and even death of wildlife. Social impacts on the communities involving the vitality from loss of lives, structures, and illness among populations, and physiological and psychological impacts such as fear, anxiety, and depression related to trauma caused from the disaster. Educational interventions to reduce negative impacts during disasters. Using models such as the Hyogo Framework for Action, or HFA, helps to guide the planning and interventions. Education planning consisting of three groups. First one is vulnerable people such as children, women, senior citizens, and disabled individuals. The second being second line people that can assist with education efforts such as politicians, teachers, and community transportation personnel. The third is the last line, which is the first line of help and rescue to the injured, such as law enforcement, military, firemen, and volunteer helpers. Importance and benefits of child education through disaster education. Providing education to children early enhances the ability to be more aware and overcome disaster situations. Children that are knowledgeable have the opportunity to increase awareness with peers and other children. Basic knowledge and assimilation of thoughts that have been taught enhances the response to adverse situations during disasters. Also, children are less likely to forget the knowledge taught even at young ages. And lastly, children represent a large group of populations around the world. Benefits of educating women. Educating women on disaster situations increases overall preparedness of their families. Children often learn from mothers, including instructions during emergency situations. In addition to additional education is needed for women that are pregnant or of childbearing ages for disaster situations. Educating disabled and elderly individuals. Education needs that are structured to facilitate health conditions of elderly and/or disabled individuals such as hearing, vision impairments, and learning disabilities is important. Also, elderly populations are vital for mental health support to younger age groups. Also, surviving a disaster can be directly linked to proper knowledge and planning in case of emergencies. Here are the 4 phases of disaster control. The first one is preparedness. Efforts in place before events happen, anticipates the needs of the population and development of goals. Also, education assessment are continuous in this phase, along with maintaining financial resources. The second phase is related to mitigation. This step involves much planning in identifying the risk of populations and communities and ways to alleviate those concerns. Thirdly is response. This step is focused to rescue of people to prevent injury and death, also assisting with basic needs and interventions to decrease further harm and destruction to the area. And lastly is recovery phase. This last step happens after the disaster event and is focused on restoration and healing of the community. The value of nurses in disaster situations. Nurses account for the majority of healthcare workers. Nurses also have the ability to serve in many ways in every phase of disasters. Nurses offer care holistically and for all levels of the community. Nurses also are able to prioritize and triage impacted individuals, and nurses also have essential knowledge and skills to assist with medical management. Implementing competence in disaster situations through nursing education. Education should be focused on communication. Nurses are known for effective communication through their profession. Planning. Nurses already have experience with planning and implementation by providing care to patients. Decontamination and safe practice. Nurses routinely practice with personal protective equipment and understand basics of infection prevention and cross-contamination. Regulatory protocols such as the Incident Command System or ICS. Nurses must follow guidelines and maintain competent practice continuously, such as Joint Commission and other accrediting agencies. Also, ethical considerations. Nurses encounter ethical concerns related to healthcare delivery and their own personal values. Decreasing disparities when disaster strikes through nursing interventions. Vulnerable populations rely heavily on the competence of healthcare workers to ensure their needs and safety is met. Nurses play a vital role in risk assessment, care planning, and delivering care to these individuals. The input from nursing leaders is essential for disaster and emergency preparedness at every level. Nurses can anticipate needs, advocate, and protect vulnerable populations that may be misrepresented. Recommended actions for improved outcomes during disaster situations. Ensuring that funding is available with continued political support for every phase of disaster preparedness. Political leaders need to plan and anticipate the need for nursing support during disaster situations, also by providing protective equipment and supplies necessary during crisis events. Transportation, childcare, and food supplies are of significant importance. Inclusion of nursing leaders with the planning and implementation for disaster management and increase the education within nursing and healthcare administration, as well as collaboration with political leaders and professional nursing organizations to activate members that are specifically trained in disaster control. Current challenges nurses face to disaster management. The lack of funding and support to promote education and evaluation from key stakeholders. The lack of formal disaster and emergency education in nursing education, incongruent methods of communication and activation related to disaster management, and inadequate representation of nursing leadership that is essential to promote and advocate to the needs of populations at most risk. Additional considerations. Educate patients to keep healthcare records in case of emergency, have health insurance cards available or copied, have important contacts and phone numbers with names available at all times, have a current list of medications and healthcare conditions, including allergies and surgical procedures on hand at all times, ensure that pertinent medications are on hand and any necessary medical supplies, and keep a current record of most recent diagnostic and laboratory results if available. Here are some additional resources on emergency preparedness: cancer.gov, FEMA, and the Red Cross. Please take the time for the post test and thank you for your participation.